All right, everyone. Welcome back to all my listeners. This is episode 5 in season 14. Today is Wednesday, January 29th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys. So let's get into today's episode. You know, it's the very last Wednesday of the month of January. I cannot believe the month is already over. But I really wanted to focus on a big bonanza episode today, right, for my Newsworthy fraud, waste, and abuse cases. There were so many to start off 2025, and we'll get into it when I start the Newsworthy feature. But I really wanted to just focus on a lot of cases that I read through and that I find incredibly important. I've worked on so many similar not cases, but charts when I'm reviewing from providers. And so I really gained a lot of insight in these various OIG press releases. So when I read them, I really hope I will, come off of the news feed and just talk about what I think and what my findings are in all of the work that I do. So I'm going to do things a bit differently for the last episode of the month, but still I will be focusing on that fraud, waste, and abuse for the month of January. And then, of course, in my trusty tip, I wanted to go ahead before the month is over. I wanted to spotlight January's Cervical Cancer Awareness Month. And of course, I'm going to go ahead and close out and round out today's episode with another remarkable quote on change by Vincent Van Gogh, one of my very favorite artists. Now, today's episode is sponsored by HCPro. Are you new to coding or looking to sharpen your coding skills? Look no further than HCPro's Certified Coder Bootcamp Original. It is the ultimate training program for mastering ICD-10-CM, CPT, and HCPCS Level 2 coding. This intensive course is designed to help healthcare professionals like you to develop a strong foundation in coding principles and guidelines. Whether you're coding for professional services or hospital outpatient settings, this bootcamp has you covered. Here's what you'll gain. Number 1, a comprehensive understanding of ICD-10-CM, CPT, and HCPCS Level 2 manuals. Number 2, you'll also gain understanding and hands-on practice with over 500 coding exercises, real-world application at its finest. And finally, third, you'll gain personalized instruction in small class sizes, ensuring that you get the attention you need to succeed. HCPro's next live in-person Certified Coder Bootcamp Original is being held in Charlotte, North Carolina, starting on Monday, March 17th, and it runs through Friday, March 21st. With more than 20 years of experience teaching coders, HCPro knows what it takes to prepare you for success. In fact, their course participants rate the bootcamp 4.9 out of 5. That's incredible. Now, as a special thank you for tuning in, they're going to be offering you, in my audience, 15% off of registration for this bootcamp. So simply use promo code SONAL15 at checkout on hcmarketplace.com. All of that information will be in my show notes. So don't wait. Take the first step towards coding confidence and career growth today. Remember, promo code SONAL15 saves you 15% on your registration. All right, you guys, let's get into it. So in this week's Newsworthy, the month's fraud, waste, and abuse cases, the month of January saw a whopping 46 cases. Again, and it's only January 29th as I'm recording. So a whopping 46 cases, and there's still a few days left to the month. And I really wanted to go big, like I stated in the beginning. I want to go big in 2025. So for this episode, I want to uncover some really important details on 9 very important cases, in my opinion. So let's get into it. Early January saw LabCorp and University Health System agreeing to pay over $300,000 to resolve alleged False Claims Act violations. Laboratory Corporation of America Holdings, or LCAH, Laboratory Corporation of America, or LCA, and LabCorp Tennessee, LLC, or LCTN, they're all collectively known as LabCorp, and University Health Systems, Inc., or UHS, have paid, again, over $300,000 to resolve allegations that they violated the False Claims Act by delaying the submission of physician orders for certain laboratory tests by Caris Life Sciences, Inc., also called Caris, to enable improper billings to Medicare for those tests. Now, during the relevant time frame, it's called Medicare's date of service or 14-day rule, prohibited laboratories from separately billing Medicare for tests performed on specimens if a physician ordered the test within 14 days of the patient's discharge from a hospital stay, either in an outpatient or inpatient setting. If the test was performed more than 14 days after discharge, then Medicare's 14-day rule permitted laboratories to bill Medicare directly for the test. If the test was performed within the 14-day window, the laboratory must instead bill the hospital facility. UHS operates University of Tennessee Medical Center, or UTMC, and LCA provides clinical laboratory services through LCTN at UTMC's outpatient laboratory. According to filed documents between March of 2012 and November of 2023, UHS and LCTN caused the delay of the submission of physician orders for Caris testing by either holding orders for submission or canceling and then resubmitting orders until 14 days after a Medicare beneficiary's discharge from the hospital to circumvent Medicare's date of service rule, which allowed the submission of claims to Medicare. The United States contends that in doing so, UHS and LCTN violated the date of service rule and knowingly caused the submission of false claims for reimbursement to Medicare. UHS and LabCorp cooperated with the United States investigation and resolution thereof. Caris, for its part, previously agreed to pay $2.8 million to resolve allegations in the Eastern District of New York of its related conduct on a nationwide scale. This particular settlement resolves in part a lawsuit filed under the QTAM or whistleblower provisions of the False Claims Act, which permits private parties to sue on behalf of the government for false claims and receive a share of any recovery. The relator received $73,846.76 of the proceeds from this settlement. UHS was not a party to the QTAM case, but they participated in the settlement. The claims resolved by this settlement are allegations only, and there has been no determination of liability. So I pulled this case because I thought it was incredibly fascinating, the fact that these large entities, large organizations, and medical centers thought that they could just go under the radar, right, and not be caught violating this very specific rule from Medicare. So we have to be really mindful of what we're doing when we receive these orders from our physicians and when claims need to be sent out for submission. So I've seen things like this. There's only a small window of time that these types of charges can be held, but then we have to push those claims out the door. So my spidey senses went up when I read that case, so I wanted to make sure I shared it with my podcast audience. All right, let's move on to the second case. Early January also saw Physicians Toxicology Laboratory and its owners to pay $4.425 million to settle allegations of unnecessary drug testing. Physicians Toxicology Laboratory, LLC, also called PTL, of Tampa, Florida, has agreed to pay $4.425 million to resolve allegations that it violated the False Claims Act, also called the FCA, by causing physicians to order medically unnecessary urine drug testing and hormone testing, and by submitting claims for reimbursement to the Medicare program for those tests. The United States alleges that PTL provided laboratory services for several medical practices in the state of Michigan. These practices ordered urine drug tests, or UDTs, for their Medicare patients, and PTL ran these tests and then billed Medicare. These practices routinely ordered two types of UDTs. One is called a presumptive urine drug screen, and the other is known as a definitive urine drug test. So there's two, presumptive and definitive. And I'm working on cases like this as we speak. So of course, when I read this entire case, I was like, I have to share it with the audience. Now, a presumptive UDT is an initial test to detect the presence or absence of a substance or class of substances in the body. Now, a definitive UDT, however, is a more advanced test that can identify individual drugs, distinguish between structural isomers, and report the results of drugs present in concentrations of nanograms per milliliter. So, of course, what can you glean between those words, right? Presumptive and definitive. So, definitive tests are going to reimburse a whole lot more than your presumptive. So, keep that in mind as I continue sharing this press release. Now, under its rules, Medicare requires that claims for UDTs be based on an individualized determination for each patient. Medicare does not cover blanket orders for UDTs. Again, blanket orders, I've seen this time and time again in my career. And I always advise that we cannot be using that type of terminology of blanket orders because we have to make sure our treatment for patients are individualized. So blanket orders are a no-no for these types of labs for the urine drug tests. Now, despite these rules, the United States alleges that from January 1st of 2017 through December 31st of 2019, PTL encouraged these medical practices in the state of Michigan to order UDTs pursuant to blanket orders for all patients without an individualized determination of medical necessity. Specifically, PTL created and encouraged the practices to use requisition forms that included a simultaneous order for both presumptive and definitive UDTs. PTL also employed and placed in-office urine collectors in the practices, and the collectors typically filled out the blanket orders before submitting them to PTL. As a result, the practices ordered medically unnecessary and non-covered UDTs from PTL, and then PTL knowingly submitted those claims to Medicare. So again, as an auditor, when I simply am privileged to look at just the claims and just the documentation, there's only so much that people like myself can do, right? There's only so much you can glean. So you have to push it to the higher up people to get investigations started. So the right people, the right authorities can be in the know for what we're actually seeing on paper, right? So there's a lot of people involved to actually investigate. Now, additionally, the United States alleges that PTL billed Medicare for urine tests for hormone levels ordered by one of the practices with almost every single UDT when the laboratory knew that the practice was ordering these tests as a form of specimen validity testing, which is already included in the reimbursed costs of UDTs. So again, right, those things are bundled already into those types of urine drug tests. Those things require multiple specimens to be tested. So again, I thought that was a really nice, well-crafted sentence in that press release. The claims resolved by these particular settlements are allegations only, and there has been no determination of liability. All right, this next case is another big one, another doozy. I work on tons of telehealth claims to this day, not just during the pandemic. I touch telehealth claims every single day. Early January saw a telehealth company paying $386,000 to resolve allegations of overbilling for Medicare telehealth time. CompreCare Health LLC and its affiliates, who are doing business as MediTeleCare LLC have agreed to pay $358,514 to resolve allegations that MediTeleCare billed Medicare for telehealth psychotherapy sessions that did not meet the minimum time requirements. CompreCare Health is a Connecticut business and provided services in at least 17 states, including Kentucky. The United States alleged that between January 1st of 2017, that's pre-pandemic, and November 30th of 2022, right in the middle of the pandemic, MediTeleCare submitted and caused the submission of claims to Medicare for telehealth psychotherapy sessions that did not meet the minimum time requirements for payments and relied on false time records in support of these same telehealth services. That is oh so shocking, right? To provide false time records. How do you figure that out, right? It's those investigators that do all of that really, really fascinating work to, decipher what is real and what is not real. The allegations arose from a whistleblower suit filed in federal court in Bowling Green, Kentucky. Or there's the whistleblower, right? There's someone on the inside who maybe left, who maybe got fired, who maybe chose to walk out the door because of the wrongdoings that were happening at their workplace, right? So folks like that, the whistleblowers, will eventually say something, like in this case. All right. Yeah. And so that case also gave me great pause because, again, the rules for our telehealth were different pre-pandemic and then in the pandemic, right? And then, of course, all of our evaluation and management types of codes that are used for telehealth, that all got a huge overhaul as well in 2021. So right in between. So there's so much that an auditor, that an analyst has to keep in mind as they're doing this type of really comprehensive work. All right, let's move on. January saw an owner of an addiction treatment chain that billed for recovery services not provided, sentenced to more than 8 years in federal prison in healthcare fraud conspiracy. Now, the owner of a now defunct Rhode Island-based chain of addiction treatment centers has been sentenced to more than 8 years in federal prison for defrauding Medicare, Medicaid, and other health insurers out of millions of dollars. The man previously admitted to a federal judge that he and his company, called Recovery Connections Centers of America, Inc., or RCCA, shortchanged patients suffering from substance abuse disorders in Rhode Island and Massachusetts by failing to provide them with required counseling sessions and treatment that were an important part of their care, while simultaneously billed Medicare, Medicaid, and other healthcare payers for those sessions. In many cases, RCCA routinely billed for 45-minute counseling sessions when in fact they were providing sessions that were only 5 to 10 minutes or less in length. That's simply appalling, right? These folks need their counseling and they were getting gypped, but the payers were being billed for these services, again, in the higher reimbursement arena, right? For 45 minutes instead. It's just shocking. All right. As described in a criminal complaint filed in this matter under the guise of running recovery clinics that supposedly provided much needed medical and therapy services to men and women in the states of Rhode Island and Massachusetts who needed help in their struggles with addiction, the defendants shortchanged their patients, providing them with little to no therapy or support, all the while billing Medicare and other insurers as if they had fully served their patients. For example, he had RCCA billed the government or insurance providers for 45-minute sessions when in fact patients were actually seen again for less than 15 minutes. In some cases, substantially less than that. One counselor was known as the, quote, 5-minute queen, end quote, because the counseling sessions would last that long and no longer. I mean, that's just abominable. In another instance, an employee was equipped with a bell that they would ring to ensure that the flow of patients moved along briskly. Wow. Super, super shocking. Yeah. So I'm working on cases like this too, every single day regarding behavioral health, addiction medicine, and all of these types of codes are time-based. And they require a certain threshold, right, to actually bill for that service. So multiple things, again, that you have to take into consideration, especially if you are trying to bill for the state as well. They often play by their own rules. And so you have to be well aware of state regulations for billing these types of addiction services. So simply fascinating and appalling that they shortchanged that population there. All right. January also saw a Chesapeake hospital indicted for healthcare fraud involving unnecessary surgical procedures. Now, this is a big case, and I'm just going to read this to you because this man just should not really have been working at this hospital. As alleged in the indictment, CRMC, that's what Chesapeake Hospital was known as, formerly known as Chesapeake Regional Hospital, CRMC. They were granted privileges. They had granted privileges to a Javed Perwaiz from 1984 until his arrest in 2019, despite knowing that Perwaiz's privileges had been terminated at another hospital for performing unnecessary surgeries that he was convicted of 2 federal felonies in 1996. From the years 2010 to 2019, CRMC allegedly received approximately $18.5 million in reimbursements from healthcare benefit programs for surgical and obstetric procedures Perwaiz performed at the facility. Beginning at least as early as January 2010 and continuing until November 2019, CRMC, Perwaiz, and some of the others, allegedly conspired to defraud the Centers for Medicare and Medicaid Services, Medicare and Medicaid, the Virginia Department of Medical Assistance Services, and TRICARE. CRMC and Perwaiz allegedly agreed to Perwaiz continually performing surgeries and other procedures at CRMC that were in violation of the rules and regulations of the healthcare benefit programs. CRMC also allegedly defrauded Medicare, Medicaid, TRICARE, Anthem, Optum, Humana, Cigna, Aetna, and United Healthcare, and others to obtain reimbursements for obstetric deliveries that were elective inductions for no medical reason before 39 weeks of gestation, contrary to medical necessity and the standard of care. So that's just shocking, to deliver these babies before 39 weeks of gestation just because that's what he wanted to do. It's just shocking. CRMC allegedly submitted such reimbursements itself and aided and abetted Perwaiz to do the same. As alleged in the indictment, Perwaiz exclusively performed his obstetric deliveries at CRMC and routinely scheduled them as elective inductions on Saturdays, a day when he was already scheduled to be at CRMC to perform surgeries. To schedule such deliveries, Perwaiz allegedly submitted to CRMC obstetric flow sheets that often had 2 different delivery dates clearly noted. One due date was accurate and within the standard of care, while the other was fabricated later by Perwaiz to appear that the patient was actually at or after 39 weeks of gestation at the time of induction or cesarean section, when she was not. A review of such forms for Medicaid patients in 2019 allegedly revealed that approximately 64% of forms were altered, resulting in about 39% of his patients of CRMC being induced before 39 weeks of gestation for no medical reason. CRMC employees and practitioners allegedly observed or were made aware of such discrepancies, but nonetheless allowed Perwaiz to continue these practices and continue billing for them. mind-boggling. The indictment alleges CRMC knew that Purwise routinely and knowingly misclassified inpatient-only surgeries as outpatient procedures, but allowed him to continue performing these surgeries. CRMC also allegedly knew that certain healthcare benefit programs would not reimburse a hospital for an inpatient procedure performed on an outpatient basis. That the majority of private healthcare benefit programs reimburse such procedures at a significantly lower rate, and that inpatient surgeries required an increased level of scrutiny. CRMC allegedly routinely allowed Purwise to deviate from scheduling policies for non-emergent surgical cases. Purwise often scheduled his Saturday surgeries on late Friday afternoons. Purwise repeatedly performed sterilizations on Medicaid patients at CRMC without valid consent forms, and CRMC allegedly knowingly allowed him to continue to do so. Wow. The indictment alleges that Purwise was a solo practitioner who applied to CRMC for privileges in September of 1983. While his application was pending, in December 1983, CRMC's president, who remained the president/chief executive officer until 2005, was notified by Maryview Hospital in Portsmouth that Purwise's privileges at Maryview had been terminated earlier that year for performing unnecessary surgeries. After review of Purwise's application, it is alleged that CRMC's Department of Surgery initially declared him unacceptable for appointment, but nonetheless granted him privileges in April of 1984. The indictment further alleges that Purwise continued to conduct office visits, in-office diagnostic procedures, inpatient and outpatient surgical procedures, and obstetric deliveries at CRMC until his arrest on November 8th of 2019. Purwise also allegedly performed all of his obstetric deliveries and inpatient surgeries, including hysterectomies and other surgeries and procedures at CRMC. The vast majority of these procedures allegedly took place on Saturdays when he had a reserved surgical block timed at CRMC. In 1995, Purwise was indicted on 6 counts of felony tax fraud in federal court. He pled guilty to 2 of the counts and admitted in public filings to extensive fraudulent conduct, including, among other things, falsely claiming a Ferrari luxury sports car as an ultrasound machine so that he could write it off as a business expense. In November of 2020, Purwise was convicted of 52 counts of healthcare fraud and false statements in healthcare matters and was sentenced to 59 years in prison. Approximately 38 counts of the convictions were for procedures performed at CRMC, including unnecessary hysterectomies and other invasive and irreversible surgeries, elective inductions prior to 39 weeks of gestation without medical justification, and sterilizations of Medicaid patients without consent forms signed 30 days in advance. The indictment alleges that CRMC periodically reviewed the credentials of practicing physicians, including Purwise, every 2 years. Purwise's recredentialing packet allegedly contained information regarding his felony conviction, his prior hospital suspension, and notes regarding medical malpractice lawsuits resulting from procedures he performed at CRMC. It is alleged that CRMC continually recredentialed Purwise approximately every 2 years between 1984 and 2019. Purwise was last recredentialed in June 2019, just 5 months before his arrest. Wow, that case was a totally huge, mind-bending, shocking one. I'm left just completely speechless. I can't believe all of that happened during all of those years, and it was allowed to continually happen. So, wow. All right, let's move on. Mid-January saw the United States and the state of North Carolina file False Claims Act complaints against a durable medical equipment supplier. Now, the United States and the state of North Carolina have filed a complaint against a DME supplier in North Carolina, alleging that the man knowingly submitted or caused to be submitted false claims to North Carolina Medicaid for more expensive medical supplies than were actually provided to the Medicaid recipients, a practice known as upcoding. And of course, I've talked about this on my podcast for years. So let's see what this is all about. As alleged in the complaint, from at least May 19th of 2017 through August 23rd of 2019, the man, through a durable medical equipment business that he opened under different names, caused the submission of false claims to North Carolina Medicaid for high reimbursing, specialized nutritional formula for individuals with rare, inherited metabolic disorders when he knew the Medicaid recipients actually received lower reimbursing items called Ensure, Pediasure, Boost, and Glucerna drinks. Now, the claims asserted against this defendant are allegations only, and there have been no determinations of liability. Now, mid-January also saw AG Nessel reaching a $19.85 million multi-state Medicaid fraud settlement with a behavioral health facility. Now, the Michigan Attorney General, Dana Nessel, announced that the state of Michigan, alongside other states and the federal government, have entered into a settlement agreement with Acadia Healthcare Company concerning allegations that their inpatient behavioral health facilities submitted false claims to government healthcare programs, primarily Medicare and Medicaid. Now, under the civil settlement agreement, Acadia is a Delaware corporation that's headquartered in Franklin, Tennessee, and they will pay $19.85 million plus interest to the states of Florida, Georgia, Michigan, and Nevada, as well as the federal government, more than $6 million of which will go to the Medicaid programs. Michigan will receive over $412,000 in Medicaid restitution and other recoveries. Now, the settlement resolves allegations involving multiple Acadia facilities in multiple states. The allegations against each of those facilities include admitting patients to the facility who are not eligible for inpatient treatment, failing to discharge patients who no longer needed inpatient care, excessive lengths for inpatient stays, inadequate staffing and insufficient staff training and supervision, resulting in assaults, elopements, suicides, and other patient harm. And finally, failing to provide inpatient care per federal and state regulations, such as failing to develop individual treatment plans, failing to provide active treatment, including individual and group therapy, and failing to provide adequate discharge planning. The investigation and settlement resulted from 2 whistleblower lawsuits filed in April of 2017 in the United States District Courts for the Eastern District of Tennessee and the Middle District of Florida, and investigations by Florida, Michigan, and Nevada involving the facilities located in those states. Okay, shocking, right? All of the behavioral health stuff that I work on, again, like I said earlier, on an everyday basis, it's just shocking, right? You just really have to pay attention to the services that you're providing your patient population. And in this case, there was severe negligence going on for these various facilities in the various states. All right. BioReference Health, LLC, formerly known as BioReference Laboratories, Inc., and OPCO Health, Inc., have agreed to pay $704,349 to resolve alleged violations of the False Claims Act arising from BioReference's submission of claims for laboratory tests that had not been ordered by a patient's provider. OPCO is a Delaware corporation. BioReference, a subsidiary of OPCO, is headquartered in New Jersey and is one of the largest clinical laboratories in the United States. The United States alleged that BioReference and OPCO knowingly submitted false claims to the federal healthcare programs for complete blood count, also called CBC, with automated white blood cell, or WBC, differential laboratory tests that were not medically necessary. Specifically, the United States alleged that from January 1st of 2012 until March 1st of 2023, BioReference and OPCO routinely performed more expensive CBC with WBC differential tests, when in fact medical providers had ordered less expensive CBC with no WBC differential tests, and then billed federal healthcare programs for the more expensive and medically unnecessary tests. The settlement stems from allegations originally brought in a lawsuit filed in the District of Delaware by a whistleblower under the qui tam provisions of the False Claims Act, which allow private parties known as relators to bring suit on behalf of the government and to share in any recovery. In connection with the announced settlement, this relator will receive $112,694 of the recovery. All right. Now, finally, the Justice Department files, this is a big case, the Justice Department files nationwide lawsuit alleging Walgreens knowingly filed millions of prescriptions that lacked a legitimate medical purpose. In a civil complaint filed in the U.S. District Court for the Northern District of Illinois, the Justice Department alleges that Walgreens Boots Alliance, Walgreen Co., and various subsidiaries, collectively known as Walgreens, dispensed millions of unlawful prescriptions in violation of the Controlled Substances Act, the CSA, and then sought reimbursement for many of these prescriptions from various federal healthcare programs in violation of the False Claims Act. Walgreens is one of the largest pharmacy chains in the country, with over 8,000 pharmacies across the U.S. The government's complaint alleges that from approximately August of 2012 through the present, Walgreens knowingly filed millions of prescriptions for controlled substances that lacked a legitimate medical purpose, were not valid, and or were not issued in the usual course of a professional's practice. Among the millions of unlawful prescriptions that Walgreens allegedly filled were prescriptions for dangerous and excessive quantities of opioids, prescriptions for early refills of opioids, and prescriptions for the especially dangerous and abused combination of drugs known as the Trinity, which is made up of an opioid, a benzodiazepine, and a muscle relaxant. The complaint alleges that Walgreens pharmacists filled these prescriptions despite clear red flags that indicated that the prescriptions were highly likely to be unlawful. Walgreens allegedly ignored substantial evidence from multiple sources that its stores were dispensing unlawful prescriptions, including from its own pharmacists and internal data. The complaint further alleges that Walgreens systematically pressured its pharmacists to fill prescriptions quickly without taking the time needed to confirm each prescription's validity. Walgreens also allegedly deprived its pharmacists of crucial information, including by preventing pharmacists from warning one another about certain prescribers. The complaint alleges that by knowingly filling unlawful prescriptions for controlled substances, Walgreens violated the CSA, the Controlled Substances Act, and where Walgreens sought reimbursement from federal healthcare programs also violated the False Claims Act. The complaint alleges that Walgreens' actions helped to fuel the prescription opioid crisis, and that in some particular tragic instances, patients died after overdosing on opioids shortly after filling unlawful prescriptions at Walgreens. If Walgreens is found liable, it could face civil penalties of up to $80,850 for each unlawful prescription filled in violation of the CSA, and treble damages, or 3 times the damages, and applicable penalties for each prescription paid by federal programs in violation of the FCA. The court also may award injunctive relief to prevent Walgreens from committing further CSA violations. 4 different whistleblowers who previously worked for Walgreens in various parts of the country filed whistleblower actions under the qui tam provisions of the FCA. Those provisions authorize private parties to sue on behalf of the United States for false claims and share in any recovery. The Act permits the United States to intervene and take over such lawsuits as it has done here. The claims asserted against these defendants, Walgreens, are allegations only, and there has been no determination of liability. And now it's time for my trusty tip. Now, for my last podcast drop of January, I wanted to share another excerpt from another article that I've published this month in BC Advantage magazine. Now, I share my spotlight on Cervical Cancer Awareness Month. It is in January. So, quote, what is cervical cancer? The cervix is what connects the body of the uterus to the vagina. Anyone with a cervix is at risk of developing cervical cancer. Cervical cancer is a disease that occurs when cells of the lining of the cervix grow out of control. Although cervical cancer starts with a glandular or squamous cells with abnormal changes, only some women with these changes of the cervix will develop cancer. For most women, these abnormal cells will just be that, abnormal cells. But in some women, these abnormal cells can develop into invasive cancers. Types of cervical cancer. There are two main types of cervical cancer: squamous cell carcinoma and adenocarcinoma. Most cervical cancers are squamous cell carcinomas. These cancers develop from cells in the exocervix, or the outer part of the cervix, seen during a speculum examination. The other cervical cancers are adenocarcinomas. Adenocarcinomas are cancers that develop from glandular cells. Cervical adenocarcinoma develops from the mucus-producing gland cells of the endocervix, or the opening of the cervix that leads to the uterus. There are less common cervical cancers that have features of both squamous cell carcinomas and adenocarcinomas. These are called adenosquamous carcinomas or mixed carcinomas. Risk factors. It's important to know the risk factors of developing cervical cancer. Known risk factors include infection by the human papillomavirus, or HPV. Another risk factor is an early sexual history with activity starting at younger than age 18. Another risk factor includes having many sexual partners who are considered to be of high risk. Another risk factor includes chlamydia infection. Yet another risk factor is long-term use of oral contraceptives. Also, 3 or more full-term pregnancies. Another one is women younger than age 20 at first full-term pregnancy. And the final risk factor includes smoking. There are also certain risk factors that you cannot change and you cannot improve. These include having a family history of cervical cancer. Another risk factor that cannot be changed includes having received diethylstilbestrol, DES, from 1938 through 1971. DES was a hormonal drug given to women to prevent miscarriages. Daughters of these women are also at increased risk of squamous cell cancers, end quote. And finally, I focus season 14 Spark on change. I want this 14th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone whose words provide us with insights and wisdom on change. So, in this week's inspiring quote in Spark is from Vincent Van Gogh. Great things are done by a series of small things brought together. So very true, right? This quote reminds us to stay hopeful and strong. My audience knows how much I love art. So when you see Van Gogh paintings, you know his very small brushstrokes create the larger beauty. We can all strive for achieving small things every day, because in the end, they will end up being great. I'm happy Vincent Van Gogh's Spark still inspires so many. All right, you guys, that wraps up today's episode. I know this was a big one, but I hope you enjoyed it. I hope you played again and learned something, from all of those cases in Newsworthy, all of those fraud, waste, and abuse cases that I went over. Because as a business of medicine professional, I think these types of cases you can learn so much from in your everyday work. For the various practitioners that you work for, the various entities that you work for. There's so much to take away from all of the no-nos that I disclose at the end of each and every month. So I hope you guys got a lot out of the first session of my Newsworthy fraud, waste, and abuse cases for 2025. I wanted this to be a big episode, so I hope you guys enjoyed it. Anyways, I hope you guys have a incredible week ahead. I wish you nothing but happiness in the next few days. It will be February. So, wow, I wonder what's going to happen in that very, very short 28-day month. I'm sure it's going to be jam-packed with more Newsworthy, more Trusty tips, and more sparks. So I hope all of you have an incredible weekend ahead. Go have some fun. All right, you guys, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.